Hi, I'm Dr. Glenn Bauman. I'm a radiation oncologist at the London Regional Cancer Program and specialize in the treatment of prostate cancer with precision radiotherapy. At this point, you'll have had an initial appointment with your urologist and radiation oncologist to talk about treatment options for your prostate cancer. I'd like to give you some details today about one of those treatment options, a specialized form of radiation treatment called brachytherapy. The word brachytherapy comes from the Greek word brachios, meaning short. It refers to the delivery of radiation that is concentrated within a few millimeters of the target area being treated. For prostate cancer patients, brachytherapy involves placement of radioactive materials, called radioactive sources, directly into the tissue of the prostate. It is often used as an alternative to surgery or other forms of radiation for patients with early-stage prostate cancer. It may also be combined with other treatments when the cancer is more advanced. There are two different types of brachytherapy. The first type, called low-dose rate brachytherapy or permanent seed brachytherapy, is used to treat patients with early-stage prostate cancer. During this treatment, we place radioactive seeds directly into your prostate. We use a needle poke made through the skin just below the prostate to carefully insert an applicator to help place these seeds. The seeds are smaller than a grain of rice and will remain radioactive for about 8 months. During that time, they slowly release radiotherapy to the prostate and the tumor. After 8 months, only a small amount of radiation remains within the seeds. The shell of the seeds will stay in your prostate permanently, but should not cause you any harm or discomfort. This form of brachytherapy allows us to give a large amount of radiation directly to the tumor, a little at a time. By focusing the radiation to the prostate gland in the tumor, we're able to help protect those surrounding organs like the bladder and the rectum. The second type of brachytherapy is called high-dose rate brachytherapy and is used to treat more advanced cancers. During a high-dose brachytherapy treatment, again, we use a needle poke through the skin to place an applicator in the prostate. A temporary implant is then used to deliver more powerful radiation to the tumor. Unlike low-dose rate brachytherapy, nothing is put in the prostate permanently. Instead, a special machine will be used to deliver the exact amount of radiation needed. Typically, high-dose rate brachytherapy is combined with other treatments, such as external beam radiation, otherwise known as X-ray beam treatment, and possibly hormonal therapy. X-ray beam treatments are usually given daily, over 3 to 5 weeks, to the prostate and the surrounding tissues. Before you receive your brachytherapy treatment, you'll have 1 or 2 visits to the hospital. During these visits, our brachytherapy nurses will have a more in-depth, personalized conversation with you about how to prepare for treatment and what you can expect during recovery. The nurses will also go over radiation safety precautions and give you any prescriptions you may need. Prescriptions typically include pain medication to treat any discomfort you might have in the days after the procedure, a pill to reduce symptoms from bladder irritation, and some antibiotics to prevent infections. You may also see one of our anesthesiologists or internists. They will ensure that you are medically fit to have a general anesthetic to put you asleep for the procedure. The brachytherapy procedure itself is done as a day surgery, so you won't need to stay at the hospital overnight. However, be prepared to stay at the hospital for most of the day, as the procedure will take 2 to 4 hours, with another 2 to 4 hours for recovery. Because you will be put to sleep for the treatment, you will need someone to drive you to and from the hospital for your appointment. Following your brachytherapy treatment, you may receive additional treatments with external beam radiotherapy or possibly hormonal therapy, depending on the treatment plan organized by your oncologist. In the next section, we'll talk more about each brachytherapy procedure and how to prepare for it.